Good afternoon, everyone. I'll jump right in with the numbers. Today, we have 13,140 negative tests, 842 positive tests, and we now have 13 deaths in the state of Wisconsin. Those 5 new deaths range in age from their 60s to their 80s. In addition, as part of our daily DHS website update, you will now be able to see that we are providing additional data points. This includes the age ranges and genders of those who have tested positive and those who have died from COVID-19. This is part of our ongoing effort to be transparent and to provide information that helps inform and protect our citizens. Now, hearing the numbers today, you may think that safer at home, physically distancing, washing your hands, and covering your coughs and sneezes aren't working. But I want to stress something we talked about earlier this week. Without implementing safer at home, our models show us that we would likely have 22,000 Wisconsinites who are infected with COVID-19 by April 8th. And so now is the time to do everything we can to flatten the curve to keep that projection from coming true. Lives truly do depend on it. And I want to spend just a minute on what you're likely to see in our daily case updates moving forward. Assuming that we are all implementing safer at home well, it will likely be several weeks before we are able to start to see the results of those efforts. And that is because of the lag time between infection to symptom onset and ultimately to a positive test result. And so the numbers you're seeing today and in the near term are people who were infected before we started safer at home. So please don't get discouraged. We need you to remain vigilant and continue to do everything we can together to stop the spread of COVID-19. It's ironic, really, that in a time when we need each other, we aren't able to be physically close to each other. We need to be 6 feet apart. We can't meet for happy hours. We can't go visit our parents or our grandparents in a nursing home or assisted living facility. But as we have talked about previously, physical distancing really is the way to stop the spread of this disease, and it does not have to equate to social dislocation, disconnection, or isolation. We are so impressed with the ways you've found to stay connected and adapted to this new normal. We are grateful for the way so many of you have asked, what can I do, instead of what's in it for me? Yet we also know that being isolated, fear of getting sick, stress from work, childcare, food, other pressures can all pile up to make you feel overwhelmed, anxious, and even depressed. Telling someone about how you're feeling isn't a sign of weakness. It's necessary for all of us to survive in this anxious and ever-changing situation. And so we want you to know about a few resources. If you need to, please call 1-800-985-5990 to speak to a trained crisis counselor, or text "Talk with Us" to 66747. Other resources to maintain your mental health and well-being can be found on the DHS COVID-19 web pages. And we will continue to talk about this issue in the future, as it will continue to be something that we all are struggling with. As we enter our first weekend with Safer at Home, the governor, DHS, and other state agencies and our local and tribal partners continue to develop and implement action steps and supports to be prepared and to do the work we need to do to respond to this outbreak, as well as to focus on our most vulnerable citizens, including our older residents. We'll continue to pursue every avenue to provide our heroic healthcare workers the equipment they need to stay safe and do their jobs, as the governor just mentioned, and we will continue to make sure we are providing you accurate, timely information to help you navigate this unprecedented situation. Finally, again, I just want to reiterate how grateful we are to each of you for your work to do this together, to really help us break the spread of COVID-19. With all of us doing our part, staying safer at home, we certainly will get through this.